Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Now let's get into the types of psoriasis. The first kind of psoriasis, as you can see in the picture, this one is called as plague psoriasis. If we take 10 cases of psoriasis, 8 cases of psoriasis will either be guttate or plague. See, guttate psoriasis can also turn into plagueular psoriasis. First we'll discuss about the plagueular psoriasis. This psoriasis usually appears on the trunk region, in the elbows and also in the folds in certain section of people. Usually it appears in the trunk region and you can see this patches. Usually it occurs because of stress and it is the most common form of psoriasis. Then coming into the guttate form of psoriasis, as you can see the plagueular one, the inflamed tissue or that plague is a little bit bigger one and it is covering a larger portion of area. Whereas the guttate psoriasis in certain sections, from the guttate it can turn into plagueular. If it is guttate, you can see that the area of the plagues are very small. This is guttate psoriasis. This can be triggered either through stress or suddenly stopping a corticosteroid treatment. And then coming into the palmoplantar psoriasis, this can either appear on the soles of the foot or on the palms. It is usually seen in children and also in adults, that is age after 50 years. So who is experiencing this palmoplantar psoriasis? For example, if you are pregnant and you have had stress in the pregnancy, the baby coming out of you can suffer from this palmoplantar psoriasis either on the palms or on the feet because of the stress. See, remember, whatever nutrition you are taking through pregnancy will be delivered to the baby, as well as the stress also. So whatever feelings, the depression, the anxiety, the panic attack, or even if you are happy, all that form of things will affect the baby which is in your belly. So if you are experiencing anxiety, if you are experiencing stress during your pregnancy, make sure you take it under control, because the baby can have a trigger of psoriasis because of the pregnancy anxiety. And also people who are of older age can also experience this palmoplantar psoriasis. Next, coming into the nail psoriasis. As you can see in the picture, it usually affects the nails as well as the nail bed also. And also, not only the nail bed, there is infection also. If you see, we touch a lot of things with our hands. When you're experiencing psoriasis near the nail area, it can cause psoriatic arthritis if it is not treated properly, and also it can become infectious if you are not washing or keeping your hands clean, because you're scratching it continuously. There is open wounds and also the infection can get, or the bacteria and yeast can get very easily inside the palm area. So remember, if you're suffering from palmoplantar psoriasis or from nail bed psoriasis, this can be infectious, or this can go into the secondary stage of infection because of the exposure to the external environment. We use a lot of our hands and our feet for working and for doing different purposes. So make sure you clean and disinfect and make sure you get treatment properly. Next, coming into the other types of psoriasis, as you can see here, this is the starting stages of psoriasis, the red scaly skin texture. And then if it is not taken proper care, this can lead into different kinds of psoriasis. Usually this can lead into plagueular kind of psoriasis. As you can see in the picture here, this is inverse psoriasis, which is usually present in the folds of the breast. It can be present in the folds near the elbow region, near the folds of the knee, anywhere the skin is folding, then you will have this kind of psoriasis. Then this is called as inverse psoriasis, usually present near the folds. Coming to this part, which is called as pustular psoriasis. See, this is not infection, this is just psoriasis which has pus in it. If not taken proper care, it can spread to the whole body, and also this can lead into infection, secondary infections also. So this pustular kind of psoriasis can be present usually on the limbs or on the hands, and even on the face and in the lesser parts like trunk. Coming to scalp psoriasis, many people who are under stress, especially men, are more prone to this scalp psoriasis. Many people in the starting stage of the psoriasis feel that it is dandruff and they take a lot of dandruff treatment, but that will also trigger or make this process run faster into psoriasis. So if you're suffering from itchy scalp, and if you're suffering from plaques which are silvery, and also if you're under certain stress, make sure that you're you differentiate if it is scalp psoriasis or if it is dandruff by consulting the doctor immediately. As I've discussed in the picture, I told you that this is the starting stages of psoriasis, and if not treated properly, certain people, when they're having a bout or a plague of psoriasis, they're exposed to sun a lot. The sun can trigger into erythrodermic psoriasis. See, remember, you can get proper vitamin D by exposure to sun either in the early morning or in the evening, but you're being exposed or sunburnt, then you can go into a state called as erythrodermic psoriasis, which can cause higher heart rate. You can have palpitation, that is, you can hear your heart rate, and also this is a widespread phenomenon. It can occur because of sunburn or because of higher use of corticosteroids. It can spread to the whole body. There will be severe itching, there will be severe burning, and also there will be disturbed or no sleep at all because of the severe itching associated with it. So if you are suffering from psoriasis, make sure that you do not go directly into the sun without proper physical measures like an umbrella, hat, or a covering. Coming to the consultation part. See, if you're suffering from psoriasis, eczema, any other skin diseases, you're looking for proper cure, and also you're looking for a good, better form of treatment, then you should be consulting Fidicus Homeopathy. So in Fidicus Homeopathy, we have in-person consultation and also online consultation. If you're staying near the nearest branch of Fidicus, we would advise you to come in person and consult us. No, if you're staying away, far away, you can get an online consultation. We have two options here. One is audio consultation and the other one is video consultation. And after the consultation, if you have any sort of skin investigations, you can share it with us. And if you need any more, we will ask you to get a skin examination or an investigation done. After the doctor consultation, the medicine will be delivered to you directly to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call through this number or WhatsApp us or ping us or messages on this number. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you are suffering from psoriasis or any other skin diseases, if you're looking for top sort of treatment, you're looking for a proper cure, doctors who will treat you properly, then you should opt for Fidicus Homeopathy. Why should you opt for Fidicus Homeopathy? Because it stands for highest chance of health. Here, because they are already treating patients who are suffering from psoriasis and other skin diseases, and the success rate is really good. We have high success rates, the transparent treatment, there's no gray area between the patient and the doctor, and also the personal care here at Fidicus, that is if you're having any sort of myths, any sort of doubts, what about doubts about your prognosis, all of this will be educated, and also the personal care is really good in Fidicus. So if you want to opt for cure, opt for Fidicus Homeopathy. Thank you.